Actemra, tocilizumab. Company, Genentech. Approval status, approved April 2011. Treatment for systemic juvenile idiopathic arthritis. Areas, musculoskeletal, pediatrics, rheumatology. Possible similar drugs, Actemra. General information, clinical results, side effects, mechanism of action, literature references, additional information. General information. Actemra, tocilizumab, is a humanized anti-IL-6 receptor monoclonal antibody. It binds specifically to IL-6 receptors. IL-6 is a pro-inflammatory cytokine produced by a variety of cell types, including T and B cells, lymphocytes, monocytes and fibroblasts. Actemra is specifically indicated for the treatment of active systemic juvenile idiopathic arthritis in patients 2 years of age and older. Actemra is supplied as a solution for intravenous infusion. The recommended dose for patients with systemic juvenile idiopathic arthritis is as follows. Patients less than 30 kg weight, 12 mg per kg once every 2 weeks as a 60-minute single intravenous drip infusion. Patients at or above 30 kg weight, 8 mg per kg once every 2 weeks as a 60-minute single intravenous drip infusion. Clinical results. FDA approval. The FDA approval of Actemra for systemic juvenile idiopathic arthritis was based on a 12-week randomized, double-blind, placebo-controlled, parallel group, 2-arm study. The subjects, N equals 75, received Actemra infusions every 2 weeks at either 8 mg per kg for patients at or above 30 kg or 12 mg per kg for patients less than 30 kg or placebo infusions every 2 weeks, N equals 37. The primary endpoint was the proportion of subjects with at least 30% improvement in GOACR corset, GOACR response, at week 12 and absence of fever. The primary endpoint was reached by 85% of the Actemra arm and 24% of the placebo arm. Secondary endpoints, including GOACR 50 and GOACR 70, were also reached. Side effects. Adverse events associated with the use of Actemra may include, but are not limited to, the following: upper respiratory tract infections, nasopharyngitis, headache, hypertension, increased ALT. Mechanism of action. Actemra is a recombinant humanized anti-human interleukin-6, IL-6, receptor monoclonal antibody of the immunoglobulin Ig-1, gamma-1, kappa, subclass. Tocilizumab binds specifically to both soluble and membrane-bound IL-6 receptors and has been shown to inhibit IL-6-mediated signaling through these receptors. IL-6 is a pleiotropic pro-inflammatory cytokine produced by a variety of cell types including T and B cells, lymphocytes, monocytes and fibroblasts. IL-6 is also produced by synovial and endothelial cells, leading to local production of IL-6 in joints affected by inflammatory processes such as rheumatoid arthritis.